So today we'll talk about caring for aging populations, and we're going to come at this from a perspective of taking care of our loved ones and being able to age well. So even if you just joined this class because it fit with your schedule, we're really going to think about how to age well from the perspective of our own selves, but also as caregivers. So my name is Abby Horton, and I'm a registered nurse. I teach here at the Capstone College of Nursing at UA. I'm a certified health and life coach, a wellbeing ambassador, and your wellness class educator. If you'd like to reach out to me for questions or comments or feedback, please feel free. My email is abby.horton@ua.edu. So we do have some upcoming events through the Wellness and Work Life Office. We've got health screenings that are happening starting in August, at August 31st or 30th, at Capitol Hall. We have some upcoming wellness classes and then also some programs that y'all might have an interest in. So please check out our website at wellness.ua.edu and sign up for our newsletter if you haven't already. And so today we're going to talk about how to plan, prepare, and care for age-related challenges, to understand some common health concerns that we may have as we age, to think about healthy aging strategies, and to discuss the role of caregiving and provide some caregiving support. And so there are a lot of myths about aging. And one of the things that I like to talk to people about anytime we're talking about health-related concerns is that there are things that are common and that are expected, but not necessarily normal. And when I say normal in air quotes, because normal is relative to our own experience. But things like declining health or disability, dementia or memory loss, those are things that are common, but doesn't necessarily have to be, quote unquote, normal. And it doesn't necessarily have to be an inevitable part of aging. So everyone who ages doesn't have declining health, doesn't have a disability, doesn't have memory loss or dementia. And certainly that can be a challenge. That can be something that we experience, but it isn't inevitable. And so another thing is that we often say that, oh, I'm too old to change my ways. I'm too stuck, or I'm too set in my ways. So this myth of you can't teach an old dog new tricks is really not true. We know that as long as we're alive and we're breathing and we're here for a purpose, and we can learn and change. It may be harder because we've developed some habits that maybe aren't as healthy or as life-giving, or it may not be serving us well in the season, but it doesn't mean that we can't change. So some things about aging that we want to think about. Life expectancy for Americans is longer than it has ever been before, but right now we're actually starting to see a decline in our life expectancy. So depending on where you get your sources, there are some reports coming out that are estimating that our children, our current children right now below age 18 may live fewer years than their parents and grandparents. And so while that is not completely confirmed and accepted in mainstream, we are seeing trends like childhood obesity and autoimmune and allergies and different things that are concerning. And so we want to think about how we can live a healthy life and how we can support those that we love to live a healthy life, whether that's you as a caregiver for older ones, maybe friends, neighbors, maybe parents, or if it's that you're wanting to age well and you're wanting to think about how to bring up the next generation aging well, this can be helpful information. Once you reach age 65, current CDC data suggests that you're likely to live another 19.3 years on average. And that is accounting for gender. So usually men live less healthy years than women and fewer years than women. But this is just the average, not counting gender in that. So, if you're like me, you have people in your family who are in their 60s and, they're almost always anticipating death or anticipating something bad happening to them. And so this is a fact that I enjoyed sharing with my own parents who are in their early 70s because you can sometimes get in that frame of mind of, oh, well, this might be my last, birthday, or this might be my last vacation, or my last this or that. But really, once you reach 65, all things considered, you might live another, 19 or 20 years. And so it's important for people to have that frame of mind because While it's good to plan ahead and it's good to think about, enjoying and savoring the moments, you don't want to live your last 20 years thinking this might be your last, vacation or holiday or special event, because that can have detrimental effects on your health and your overall well-being, and certainly on your mental health. For many people who are living, in this age range, what we would consider, age 60 or 65 plus, what would be considered, elderly population. Senior living includes carefully managing chronic conditions while also possibly acting as a caregiver to others. So even those who are in their early 60s may be acting as a caregiver. They may be fortunate enough to still have family members who may be in their 70s or 80s or beyond. So of course, siblings, we might be caring for siblings. I often talk about parents and children, but siblings also could be someone that you're thinking of as well. So healthy living as we age, there are physiological changes that happen that are just a natural part of aging. There are some diseases and conditions that become more prominent, so heart disease, cancer, and really that's about the environmental impact, not necessarily age, but it's just about exposure and how much exposure you've had to toxins and how much repair your body has had to do. There are also some psychological and psychosocial needs that can change. So you may need more support. We often think about the midlife crisis. Stereotypically, we think of a midlife crisis as being associated with men in their early 40s. Certainly pop culture tells us that that's what we're supposed to expect. And then, of course, women are often, more thinking about menopause and hormonal changes in their 40s and 50s. And so, again, both of those can be very stereotypical situations. We can age well. We can go through our 40s without having a midlife crisis. And we can also go through menopause without having all of the many symptoms and challenges that we tend to think about when we think about menopause in the US. So other needs could change as well, because you could be considered in that sandwich generation of you have more responsibilities at work while also maybe having dependents at home. Maybe you have children or other folks that are depending on you. Then you also may have those, folks in your life that you're trying to caregive for, whether they're family or friends or whatnot. And so you may feel a lot of stress and a lot of pressure, and it's that sandwich generation where you feel like you're getting pressure from both sides, both at home and at work. So psychological needs can be there. Also, we're often invited to think about our midlife, when we are reaching our 40s and 50s. And so we start to do a lot of reflection and introspection sometimes, and that can bring up some challenging emotions. A balanced diet and regular exercise are always going to be good for you and help with better health outcomes. Sleep is also an important part of that. So you want to think about controlling what you can control in terms of how you sleep, how you eat, how you exercise. Routine screenings and preventative measures are really important and encouraged. Of course, you can get a lot of those benefits through our Wellbama programming, where not only is it free, but you also get incentives to participate. So up to $100 if you do your wellness class program, screening, and class. So that's always nice. And then think about some safety measures within the home, especially if you're caregiving for people who live within your house. There might be things like throw rugs or low lighting that you might need to take care of to make your house a safer home for those, whether it's children or pets or maybe elderly folks in your home. So how does the body change? The body changes throughout all of our body systems, and it's uniquely impacted by aging, but it's also bio-individual. So for everyone on the call, if we were all the same age, we would all have different challenges. We would all have different, signs and symptoms of aging. We would also, age differently depending on our lifestyle, depending on our genetic background. And so aging is very unique, and it's something that we're going to talk about in general terms just to give you an idea of what to expect. So the body changes with your skin, your bones, your mobility and balance. Your body shape can even change. Hormonal changes certainly start to occur. But again, it doesn't have to be as overly symptomatic as what we see in pop culture. You always hear about the worst case scenarios. I always tell my nursing students, you're going to get in the textbook and in class the absolute kind of most extreme example that you can get, because that's how we teach in healthcare. But you certainly can see a whole range of changes. So with your skin, it usually does become less flexible. It becomes thinner and more fragile. You may have more wrinkles or more bruising just because you start to lose some of the collagen and elasticity in your skin and in your cells. And so age spots and skin tags may appear. Of course, that also can be relative to the sun that you get. It can be relative to your insulin resistance. Those who have insulin resistance, meaning that they have a hard time lowering their insulin, not just that they may be diabetic, can also develop some skin tags. And then skin can become more dry. And so then that's going to put you at more susceptibility with the less flexible skin, and the more fragile skin that's dry can also really tear pretty easily, and it can be hard for wound healing. So if you have an injury or a surgery or something, as you age, you want to make sure that you're paying close attention to how your wounds and things are healing. Bones and joints and muscles, your bones do start to lose density. And we always say, drink more milk, but really dairy is not the best source of calcium. There are other plants and vegetables and things that are a better source, a healthier source. Many people have allergies and sensitivities to dairy and just don't realize it. So do your research there and look at the fruits and vegetables and other sources of minerals that you can get your calcium. It's always better to eat and drink, naturally occurring sources of our vitamins and minerals and electrolytes versus taking a supplement, but then supplement, according to your healthcare provider as needed. Your joints can also become inflamed and painful and less flexible, not only due to wear and tear, but also because of injuries or accidents. But also because your skin and your muscles are starting to change. You can start to have muscle atrophy, meaning your muscles start having a harder time maintaining their shape and their form. And then with that skin, that collagen is going to also act internally, not just on the top and surface of your skin, but internally it's going to cause some changes too. So doing things like taking collagen, making sure that you're drinking water with electrolytes, making sure that you're stretching and walking. Those are two great things to do to age well. That can help with your mobility and balance as well. With balance, you typically think that there may be something going on with the nervous system or with the ears. So if you are having balance issues, it's something that you want to talk to your healthcare provider about. You can even go see a physical therapist who's trained in looking at equilibrium issues, and they can give you exercises to help with that. It's been hugely beneficial for many people that I know who've gone to physical therapy and addressed that. That does not have to be a normal part of aging for you. And there may be something underlying it that you need to address. Body shape. So we start to tend to put more weight on our abdomen area. So our redistribution of weight tends to occur, and we can have some reduced fat metabolism, some hormonal changes. All of that can start to be seen in our weight distribution. But again, you don't want to just accept all of these things as normal parts of aging. You want to see if there's something else going on. Again, it may be stress related. It may be that you've had a change in your diet or exercise. And so don't just write everything off as an age related concern. It could be something else that you could actually address and you could prevent, or you could change the outcome. Hormonal changes are going to happen, but you also want to think about your blood sugar, how many carbs you're eating in terms of, simple carbs. Simple carbs are going to turn to sugar a lot faster. You want to really think about full fiber carbohydrates or complex carbs when you eat, and that you're eating those carbs with protein and fat so that you're not bottoming out your blood sugar after you've had big spikes in it. Again, I always like to tell people when I talk about blood sugar, inflammation, insulin resistance, those are the things that are really driving chronic disease today. So if you see a lot of fluctuations in your mood or your energy level, think about whether or not you're having some issues with your blood sugar. People who have anxiety often think it's just, a mental health issue, and really it could be. And it's hard to sometimes differentiate from that, but it could be that you're having a lot of spikes and fluctuations in your blood sugar, and that can cause anxiety because it's our body's way of getting our attention that something's wrong. And if we just automatically go to the psychosocial or the mental health aspect of it, we may miss some important information. Alterations in our sexual hormones also occur. So our thyroid can be affected, our cholesterol can be affected, our sex hormones can be affected, things like estrogen, progesterone, testosterone, which can lead to some issues with our sexual health. We also can have vitamin and nutrient absorption issues. And so, I feel like every time I talk about something food related or nutrition related, I have a new addition. So, we used to say you are what you eat. And then we kind of moved toward you are what you absorb. And now the latest thing that I've read is you're not only are you what you eat, but you're what you're eating, you're absorbing, and you're metabolizing. So that's an important addition. So we aren't just what we eat, but it is important that we're eating things that we want to give life. Because if we're eating processed, kind of dead food that doesn't have nutrients, and it was made in a factory, a different kind of plant, it wasn't made in an actual plant, outdoors, then we're probably not going to feel our best. And a lot of times what we think is healthy, these prepackaged, weight loss foods and things that we say are healthy aren't always healthy. Even a banana, for someone who has insulin resistance, a banana or oatmeal, which we say is healthy, can really not be healthy for a person who has insulin issues. And so I want us to kind of get away from thinking about something as good or bad or something's healthy or unhealthy, and really think about it in terms of it just may not be the healthiest choice for you personally. So vitamin and nutrient absorption are very, very important. You also can have issues with your teeth and gums. It's really recommended that you go to the dentist at least twice a year. Some naturopathic dentists or holistic dentists will actually say every 3 months is a newer recommendation. Of course, insurance does not cover that, but it is important for you to take good care of your teeth and your gums. Good dental hygiene can impact all the body systems, and so the oral microbiome that's in your mouth really impacts your gut health and your heart. It impacts everything, but those are two that you really traditionally think about. So think about, do you have dry mouth? Are your gums starting to recede? Are you having some cavities or other changes with your health? Look at your teeth and gums and see if that's a challenge. Ask your dentist, ask your oral dental hygienist, and see if there are some things that you can address proactively. Hair and nails, of course, your hair can become thinner and weaker due to a loss of collagen. It also can start to change because of thyroid health. And so thyroid is our engine. It's what fuels us. It's that butterfly-shaped gland in our neck. And so, again, it could be aging, but it might be thyroid. And so think about having those levels checked when you go to your healthcare provider. Nails can become dry and brittle. You can also have thickening or more likely to have fungal infections because of the skin changes. So think about if that's become an issue for you. Memory does get harder. And again, I think some of it is that we have a lot on our plates and we're asking ourselves and our brains to keep up with a lot of information. So focus issues, memory issues, again, could be age related, but it also could be just overwhelm. It could be burnout. Could be a lot of things. And so it also could be that you do have, early signs of memory issues or memory impairment. So think about that. Alzheimer's was always thought of as the only dementia, but now dementia is the umbrella term and Alzheimer's is just one type of dementia. And dementia is really fueled a lot of times by inflammation because our brains are getting so much inflammation to process. So we really want to think about how to reduce our inflammation overall for good brain health and just overall good health. Immunity can also become weaker. Our immune system can get a little bit less effective in terms of our white blood cells being responsive. Again, very common. It doesn't have to always be the case. You just got to take good care of your body and give your body what it needs to actually be able to protect itself. And so you do that with good hydration, good food choices, sleep, and managing your stress. Hearing can change. Again, this is something that is very common, and it may just become more noticeable as you age, or it actually might worsen as you age. There are about 3 to 4 periods in your life where your hearing acuity can change just based on the hormones and, the years that you've been using your ears. There's a lot that goes into thinking about our hearing. When you're born, when you're kind of in your first, kind of adolescent stage where you're starting to get hormones on board, Again, kind of around midlife, and they do this by gender. So it changes a little bit between males and females just because of our hormone situation. And then again, when we get to that older years, kind of 60s, 70s plus, it can change again. Certainly, that is an oversimplification. An audiologist would probably have a lot more nuance to share with you there. But just know that we usually only screen in K through 12 for hearing. And so, if you're like me and you haven't had a hearing test in a while, then, once you left K through 12 school, you may not even go and have your hearing checked or assessed unless there's a problem. And so you're only going to know that if you're starting to miss information. And that can be really, really difficult to realize that you're missing something if people don't say, hey, did you hear that? And so if you're having to have people repeat stuff a lot to you, if you're missing out on things in conversations, especially if there's a lot of background noise, like if there's a restaurant and it's hard for you to hear, it may just be really loud, but it could be that you're having an issue. There's also things like auditory processing disorder that becomes more noticeable as you age. And so if you're having difficulties or asking people to repeat things a lot or missing something in a conversation, you may want to ask if it would be appropriate to have a hearing test with a registered audiologist. And we have a lot of great audiology services in Tuscaloosa and in Birmingham. Vision, I'm really passionate about hearing and vision because I think we sometimes overlook that, especially with our overall health. Dental, of course, we do overlook because I think we sometimes only go if we have a problem in these three areas. We don't do a lot of prevention sometimes. So vision, you want to make sure that as you are working on your computer, that you're wearing blue light blockers. Obviously that'd be good for me to have on right now, but you want to think about having some type of drop to keep your eyes moist as you age. Those eyes become drier. Everything kind of dries out a little bit. That's why water with electrolytes is so important. But things like using a lubricating drop that's non-medicated can be really helpful. And I like Bio True drops. I think those are really one of my favorites that I've personally used. You can get them at a local, big box store or pharmacy. They're easy to come by. You can even order them, on Amazon. But your lens of your eye can change, and you can have eye issues because of brain and neurological challenges, or you can have eye issues because your actual eye structure is having a challenge. Same thing with your hearing. Hearing can be impacted because the actual cochlear part of your ear is having a problem, or it could be a brain or neurological issue. So if you go to get your hearing done and you have your hearing test or your vision test, and they're like, oh, your eyes are perfect, your ears are perfect, but you're still having problems, that doesn't mean that you're not having a problem. It just means it's not the actual eye or it's not the actual ear, but it could be a brain or neurological issue going on. So still pursue help for that. I feel like people don't realize that there's more help beyond just having a perfect hearing or vision screen. I always do recommend for vision that you go to an ophthalmologist, depending on your circumstances financially and your risk factors. I think it's really important to have a dilated eye exam every year or based on what your ophthalmologist recommends. To make sure that they're actually dilating your eyes and checking the vessels and making sure that those are healthy. You don't always get that level of, eye care at an optometrist because they're more concerned about your visual acuity, how well you can see, and fitting you with glasses. But for folks who have, cardiovascular issues, heart issues, inflammation, chronic issues, with your vessels or things like that, you're going to want to make sure that your eyes are staying healthy and that you're protecting your eyesight. Taste and smell can diminish. You can have poor appetite because if you can't taste or smell, your appetite is going to be a challenge. You also can have weight gain or weight loss because if you're not feeling satiated with what you're eating because you can't smell it or taste it, you may overeat. And then you can have safety concerns because you don't know if food is, spoiled or if something, isn't setting well with you if you can't taste or smell it. Certainly, we all got a little bit of, a preview of what that's like with COVID for those of us who lost taste and smell with COVID, which I did. That is something that you can definitely see. People who have chronic allergies, sinusitis like I do, or who've had any kind of nasal repair like I have, also have challenges with taste and smell, and those go hand in hand. So this can all just get amplified as you age. Hand dexterity often does diminish. And again, it's probably because we're not using those muscles, but it also is because of the loss of collagen and all of the other things, wear and tear. So that can lead to difficulty opening things, or you can drop things more readily. Here's the thing though, if you don't use it, you lose it. So if you're a helper and you like helping other people, whether it's small children or it's older folks who are losing some of their dexterity or coordination, you want to help people for sure when they need it, but you don't want to over help, because if you start doing things for them, then they're going to lose the ability to do it for themselves. And so it's really important to use what you've got. And so let them try, even if they can't do it, just like you would with a small child. You would let them try to open packages or open food or things, containers. Let your family members try, because that's going to keep engaging those muscles and keep those muscles firing. So try not to overhelp. Bowel and bladder, you can have more constipation, difficulty urinating, and frequency. Again, if you're constipated, it can make it difficult on your bladder, because depending on your anatomy, it could press against those ureters in your bladder. So you could have, both issues going on at the same time. You solve one, you might solve the other. But again, remember, everything is kind of becoming dry. Think of a desert. And so constipation usually happens unless there's something else going on, because we don't have enough water on board, or we've eaten something that's not going well. Maybe we're taking a medication that really dries us out. If you're trying to dry up all of this, mucus and nasal congestion like we tend to always have in the South, you're also, pulling that extra water from your bowels. And so you're also going to have probably constipation, because you're drying everything up. It doesn't know to just get the mucus and the drainage up here, it gets all of the extra fluid. So if you're constantly taking allergy medications or things like that, that may be an issue for you. Of course, pain medication will do that as well. Sleep patterns can change. You can often start waking up in the middle of the night. It's really common to wake up at like 2 to 4 in the morning. Again, there are a lot of theories as to why that is, but just try to get as much sleep as you can. It may be that going to bed, earlier could help, or staying in bed later could help. It just depends on your individual schedule. But duration and quality of sleep can impact your health dramatically. And so you want to really keep an eye on that if that's an issue. And, we have a lot of resources through Wellbeing about sleep. We have a Sleep More, Stress Less program coming up this fall with Dr. Pat Carter. She is a sleep expert, and so she will be bringing you lots of good information about how to improve your sleep. It's one of those foundational, to me, top 5 health, patterns that you really need to be cognizant of and working toward improving. It also can be very frustrating though, because you can do all the right things and you still can have poor sleep. So common health concerns: cancer, diabetes, dementia, osteoporosis, COPD, which is, that shortness of breath and lung issues, flu, of course, COVID, pneumonia, shingles, and then mental health or depression is going to be the most common health concerns that we see as we age, 60 plus. Other common concerns that are more kind of psychosocial would be things like, for socioeconomic, even housing, transportation, thinking about retirement with our finances, end of life decisions, legal concerns, thinking about our care, if we're going to care at home, if we're going to have home health or hospice or palliative care. Do we want to stay at home for our retirement years? Do we want to go to a community? Do we need skilled nursing care? Or can we live, in an assisted living home? The financial concerns related to that. Respite care for caregivers, again, memory loss, elder abuse, safety within the home and just in general, mental health, wellness, and then even things like wanting to hang on to things that you just maybe feel pressured to part with. So things like hoarding, or having difficulty letting our clutter or our precious belongings go. So those can be common concerns as we age. Other things like falls, home safety, like those rugs and that low lighting, financial concerns, or even poverty. Women are more likely to live longer than men. but the recommendations for financial planning are typically based on a male lifespan. And so you want to make sure that when you're talking to, our retirement, staff members here at the university who are very cognizant of that and very good about working with you in terms of, our retirement and how to plan for retirement financially. Not everyone is so well versed in that. So you want to make sure that when you are setting up your retirement accounts and you're making your plans, that you're accounting for, the lifespan for you, what would be most likely, so that you have enough money allocated and planned for. So do some research on that. It's really interesting when you start to think about how that could be an inequity or a disparity, a gap in coverage, because those guidelines are not updated for females. Health insurance, of course, is important. Having health insurance after retirement is something to think about. Asking about what those rates would look like once you retire, because our rates do change once retirement kicks in. And then having good healthcare access may not be a concern for many of the people on the call today, but it might be more of a concern for family members or for you as you go into retirement years. And so if you haven't made an appointment with the retirement staff here who walk you through that in HR and some of our other reps, I highly encourage it. I did that in my early 30s, and it was a bit of a surprise when I came to the appointment, because I think they're usually expecting people a little nearer retirement than I was at the time. But I went as a new employee because I wanted to make sure that when I set everything up, that I was setting it up to be successful and to have that money available when I needed it. So definitely go, even if you feel like you might not be at that stage. It's important to plan. So identify your resources. Again, there are some great resources on the hrua.edu website, really expanding your knowledge about, what you need to think about, not only for yourselves, but for your loved ones, developing a care plan, and then really prioritizing your health and well-being. And so I've linked to all of those resources here. And if you would like a copy of the presentation, I believe Miranda will pop that in the chat. She also put a reminder in about the orientation and the registration for the Sleep More, Stress Less program. So that deadline is going to be coming up soon. So caregiving for aging populations. I mentioned the sandwich generation earlier, putting Pickles on the side. It says, if you suddenly find yourself caught between parenting your children and caring for the needs of your aging parents, you're a part of the so-called sandwich generation. For those stuck in the middle, stress and obligations can quickly pile on. Finding time for you can be a real pickle. So put the pickles on the side. Set aside a few moments within each week in which you can focus on yourself. Take time to cultivate healthy habits, relax, and enjoy some time for yourself. So I know that is so easy to say and so very hard to do. As someone who teaches about this and who really understands and knows the right things to do, it is so difficult to actually carve out time, especially on the eve before fall semester starts, and everything gets a little bit chaotic, and just the fast-paced life picks back up. It's so hard to prioritize yourself. But what I would encourage you to do is to block out 1 hour every week in your calendar. So just go to Outlook and make an appointment with yourself. And that could be, a time where you would normally take lunch. That could be an afternoon where you would normally have an appointment. But take an hour and just set aside some time to reflect, to get caught up on some, thinking about your work. A lot of the work that we do in higher education, whether you're faculty or staff, it's thinking about things, it's processing things. And if we're always in work mode, sometimes we can get behind, so to speak, because we're not thinking ahead and not really planning out where we might have some challenges, or planning out where we might have some, issues that come up. And so we can kind of get caught off guard because we just don't build margin into our schedules. So make an appointment with yourself for 30 minutes or an hour once a week to really dig in and figure out, okay, where am I? What do I have to get done this week? What's most important? And then take some time for you personally to do that for your personal life. And then once you do that, you'll be able to start adding in more and more of that self-care time. So for the caregiver, we know that when we look at caregivers, their health tends to decline as they care for their loved one. So typically what happens is your body is able to respond when you're caregiving because it's in a stressful moment. And so you get all of those good, energy inducing stress hormones that keep you kind of going on adrenaline, basically. But then when you get a break from caregiving, whether that's unfortunately, maybe your loved one has passed away, or maybe your loved one has gone to live with someone else, or gone to an assisted living, or maybe you just get a weekend off, or you get someone else to come in for a few hours. A lot of times when you get that break, it's true with small children. You get the break and then you get sick, or have an exacerbation of your own health condition, because it's like you get to the weekend and you push through the work week, and then you wake up on Saturday morning and you're sick, and you're like, why is it always Saturday? It's because you stopped. When your momentum stopped, then your body was like, okay, and now I will be sick because you haven't given it time any other time to be sick. Same with caregiving. There are a lot of research studies that support that. So even if you push through, even if you think you're doing fine, check in with yourself, take a break, pause, and make sure that you really are truly good. You also want to make sure that you're keeping your own appointments for yourself, because so oftentimes you prioritize your loved one's appointments and not your own. Same thing as, with parenting, we do the same thing. Your kids might get to the dentist, but you never get your appointment because you just don't prioritize it. Well, keep all of your appointments for yourself. And it's just like putting your oxygen mask on first. It's so very important, because if you can't take care of yourself, and then you feel this huge responsibility for all these other folks, you're going to just compound the stress that you're having. Monitoring your mental health is also really important, as well as reaching out for professional help. A lot of times I think what we have seen a shift away from in our culture is really that community of having your neighbors be your friends and can help you, having that support outside of your immediate family is so helpful and so reassuring. But I wonder how much of that we have today, especially as we're moving more and more away from, our families, our families of origin. Maybe our, families are on the other side of the country, and we're here. We just have such a global community. It takes a lot more intentionality to cultivate that where you are. It always is a good feeling to have someone that you can call in the middle of the night if you have a sick kid, or a sick loved one, or you have an emergency. It's good to know that you have a couple of people you can call if you needed to. So reach out for professional help, but also cultivate that circle of support too. Practice good stress management, really acknowledging that stress is normal, but that you may be having abnormal levels of stress and you may need to do something about it. We're not going to be totally stress-free. I always joke that is a, playlist on Spotify, but that is not reality. If you're alive and breathing, you have stress, and that is okay. Stress can be really good and helpful. You just don't want it to get to the point where it overwhelms you. Practicing mindfulness and meditation, seeking respite care, formal respite care. If you do have someone who is really ill, there are a lot of support and resources in the community. Setting healthy boundaries. Boundaries are not about how other people act. Your healthy boundaries are about how you're going to act when someone does something that violates a value or a boundary, or something, in your life. So healthy boundaries are not about, well, they did this, so I'm going to do that. Healthy boundaries are about, I need some time, so I have been invited to this event, but I'm going to have to say no this time because that's not something I can do. So it's not about changing someone else's behavior, which I think is how we talk about healthy boundaries a lot. Healthy boundaries is about how we're going to react or respond when something comes up in our lives. So if that sounds like that's something new, there's tons of resources out there on setting healthy boundaries. And that's something I've had to work on. Acknowledge and honor your emotions and your feelings. We always kind of talk about feel your feelings in mental health, which is my background. And so oftentimes we don't feel our feelings. We eat our feelings, or we ignore our feelings, or we self-medicate our feelings in some way. But the things that we don't acknowledge are going to just keep coming back over and over again. And so if you feel disappointed, or if you feel stressed, or if you feel tired, or if you feel overwhelmed, just sit with that emotion and feel it and acknowledge it and let it be okay. Because once you do that, you can start to move forward. And then ask for help as soon as you know you need it. That's what I always tell my students. Usually we wait to ask for help when we need the true lifeline. And usually we know we need help much sooner than that, but we just are so embarrassed or prideful, or maybe we just aren't taking time to realize that we need help. And so we wait too late to ask for it. Find a support group and connect with other people who are in similar situations. For the purposes of this, I said caregivers, but find people who are going through the same challenges as you, but also look for people who've been where you are and are successfully on the other side of it. So for me, mentorship is really important. So I have different types of mentors. I have a mom that is a little bit further ahead of me on her mom journey. She has kids who are older than my kids. And so I can ask her, hey, how did you navigate getting a driver's license for your first child? Because that's something that's coming up for us. My oldest will be 15 this year, and she'll be getting her permit in November, hopefully. And so, that's a concern for me. So I had to ask, how did you handle that? These are the emotions I'm having with that. I have mentors at work that I turn to for different types of challenges. So I have different mentors at work for different things. I have mentors in other aspects of my life. And so reach out for those friendships and connections. They may be formal or informal mentors, but I think it's important to have different people at different phases of life in different areas of life to kind of give you some guidance, and just to be an ear when you need to be able to say, hey, this is a challenge. What would you do? Or how did you handle this? And then take time for yourself. Healthy aging is possible. That's what I want you to walk away from this with. Even for folks who are having health challenges, health is still an option. You're never so far gone, in my opinion, that you can't get some improvement in your health. Obviously, there's certainly illnesses and diseases that are more of a challenge. And unfortunately, we live in a world with terminal illness and cancers and things, and we've walked through that journey in my family. So I understand that that's a challenge. My husband has had cancer multiple times over the last 10 or 15 years. And so I don't want to negate that experience, because I think that that's a really hard situation, and certainly something I've walked through personally and professionally. But I do think that there's always room to be a little bit more pain-free. I think there's always room to be a little bit healthier, to sleep a little bit better. And that's what I want the message to be. You may not have a cure, that may not be possible, but you can always find a little bit of a healthy aspect to something that you're working on. So I hope that's encouraging to you. So if you're sitting here and you are a caregiver, or you're thinking about your own health concerns, think about the one or two things that are causing the most concern for you. What's the most challenging? Is it that you have trouble standing or walking? Is it that you feel like your evenings are taken up by caregiving or parenting? Is it that you, need to know your neighbors so that you have someone that you could call in the middle of the night? Identify those areas of concern and just focus on changing one thing at a time. Use the resources that we've provided and that we have in our community and here at UA to make changes, and then really track your progress. So if you need to talk to a counselor, we have counseling services. If you need to talk to any of the EAP staff, we've got EAP resources online. We've got medical professionals over at UMC, University Medical Center. We've got registered dietitians. We've got experts that come and do free Wellbama programming like this. There's just so many free resources that you get by being connected to the UA community that you can use, and then even more that you can use in the broader community. So track your progress. I always tell people, we have that old adage of the windshield is bigger than the rearview mirror because we want you looking ahead. And that is so great. But I always want y'all to think about questioning those kind of old, phrases and those old, statements that we just kind of throw around, those phrases that we say. Really question their validity sometimes, because yes, you do want to be looking forward and thinking forward momentum. That's great. But if you never look in the rearview mirror and you never think about where you've come from and how far you've come from, what you've done yesterday, what you did 2 days ago, what you did last year, it's really easy to get so caught up in chasing that elusive carrot of, okay, I'm going to go to the next goal. that if you haven't tracked your progress, you forget how far you've come. So when I get hung up on my wellness journey or my weight loss journey, I go back and I look at old photos of myself. I go back and I look at old, journals where I've written my progress down, because when I get kind of stuck and I get overwhelmed, I can look and think, wow, I may not be where I want to be right now, but look how far I've come. And that's so important, to really celebrating our successes and not staying so mentally fatigued by always trying to be more or better or do more. So how do we live longer, healthier lives? We take our annual physical exams. We do our well-being programs. We do our routine preventative screenings. We eat a healthy diet. We exercise regularly. And that is something as simple as walking and stretching. It doesn't have to be fancy. It doesn't have to be CrossFit or, a HIIT workout. It can just be walking and stretching. Staying active and engaged. That's so important once you retire, to stay active and engaged, and to feel like you have some meaning and purpose. People who have meaning and purpose, like there's a study that shows grandparents who watch their grandchildren are more likely to have better health outcomes and live longer, because they feel like they have meaning and purpose outside of themselves. Same thing with like volunteering or things like that. Maintaining a healthy BMI, avoiding unhealthy behaviors like smoking or excessive alcohol use, etc., and then creating a healthy lifestyle at home and at work. So focus on your gratitude. I think that's so important, because it's so easy to see what we don't have or to see what we're frustrated by. So, kind of keeping up with, in this moment, I'm grateful for, even though I'm stressed. That's something that we have to do a lot, I think, at the beginning of a semester when there's a lot to be stressed about. Acknowledging and expressing your feelings, like I mentioned, accepting what's beyond your control and controlling what you can control, which is usually your attitude and your effort. And then look for the silver lining. What is the positive of this situation? Find that meaning and joy, developing a hobby, staying involved in your community, traveling somewhere new, trying something new. If that, is something that you need to think about, ask yourself, when is the last time I've done something for the first time? Spend time out in nature. About 21 minutes is how long you need to spend out in nature every day to start to see cortisol, which is your stress hormone, decline. So I would say go for 30 minutes, and that'll help with your vitamin D synthesis, and that will help you reduce your stress hormones. And then volunteering is always a good way to stay involved. You also want to stay connected, so cultivate those relationships, your friends, your family, connect with them, make new friends. That's so easy to forget to do once we get out of college. We get stuck in our same routines. Spend some time with someone new every day. That's easy to do. If we put our phones down, we can meet a new friend at the grocery store. Find support groups during your seasons of change. And you might even consider adopting a pet, or maybe even having a plant, just something that needs you. That's really important. Staying active, exercising, eating well, getting plenty of rest and sleep. So not just sleep, but rest. So make sure that you're getting 5 to 15 minutes of rest 2 to 3 times a day, morning, afternoon, and evening. Being mindful, really giving your brain a break, limiting that alcohol consumption, avoiding the smoking, the tobacco products, the e-cigs, the vapes, and all of that good stuff that we know is not healthy for us. Staying mentally sharp, trying a new activity, learning a new subject, staying engaged, making adjustments to your life as needed. Thinking about our lives as seasons where, in this season of life, you may need to do something slightly different than you did in the last season. That's okay. And then thinking about your long-term plans. So we're planning for retirement and healthcare costs now, and thinking about, your power of attorney, your wills, your medical health care proxy, having beneficiaries set up for your retirement accounts and all of your other financials. Maybe thinking about having a planner that has your most important information that you can secure somewhere safely. Those are all important things to think about, so that as you're starting to transition in a different season of life, and doing this for the ones that you're caring for as much as you can now, can really save some stress in the long term. And then this is just a toolkit for healthy aging. So things that you can do for your mind, body, and spirit, and remembering that we're holistic people. We teach in medicine and in nursing about the kidneys, and we teach about the brain, and we teach about the liver and the lungs, but we're more than just like one body system. Our mind, our body, our spirit all work together. And so treating our health as a holistic, one human being is so important, and not just treating, a sign or a symptom or a body part. So meditation, gratitude, reflective journaling, counseling, yoga, being out in nature, spiritual and faith practices will help you with your mind and with your spiritual aspects, and then your body. Things that you want to just avoid. You want to avoid all of the fad diets and trends. There's so many things that have conflicting information in terms about what's healthy and what isn't. Just use common sense. Common sense of, obviously I don't need to eat a bag of chips every day, or a dessert every day, or making incremental changes versus trying to do all or nothing. Those are just things that can help you on your journey. We have other archived webinars that you can go to for some more inspiration in terms of health and fitness, things like the wellness basics, healthy habits, cardiovascular health. Those are 3 good ones that y'all could go check out that are on the archived webinars on the wellness.ua.edu site. Keep your routine appointments, like I mentioned. So this is just a checklist of ones that I've mentioned earlier. Personal training is one that a lot of people don't do, but I think is really great in terms of strength training and building good, healthy habits, but also nutritional consult, hearing screens you could do over at UAE Speech and Hearing. Just so many great resources here on campus. And then keeping track of your progress, like I mentioned, could be something like having an actual journal, or it could just be keeping notes in your notes app. It doesn't have to be something that is difficult to do. It can be something that is really easy. I say make it as fun and as free as it can be. We had someone list a resource for Ollie in the Q&A, and so I'm going to post that in the chat so that y'all can see it. Thank you for sharing that. And then just remember that slow progress is still progress. So some apps that I like to use, the Think Dirty and the Sift are all about clean living lifestyle. Yoga Nidra is about meditation, as well as Calm. Map My Walk and My Fitness Pal help with nutrition and exercise. So I'm sure there are many others that y'all can list. And if y'all have a favorite app, please feel free to put it in the chat. But these are some ones that you can get started with that are pretty cheap or free. And then I always like to tell people you're never too old to set another goal or to dream a new dream. So it's Strive for 5. Thanks, Miranda, for posting that link. That's another great program to get started on your health goals. So this is what I always like to remind people of, is that you're never too old to do what you want to do with your life. It's always okay to start over, to reinvent, to think of new things that will add, pleasure and joy to your life. I have to tell my parents that all the time. My mom will always say to the kids, Grammy's too old to do that. And I always say, don't tell the kids that. You're never too old. So we have a weekly reminder at our house for that. But it's true. Sometimes we do get stuck into thinking that we're too something, we're too far gone, or we're too far into this, or we're too old. And never, never, never. Always remind yourself that you can always start over. So Arthur Ashe says, start where you are, use what you have, and do what you can. So again, any class that I always, want to remind you, just do what you can with what you have, and always start today. Don't get overwhelmed. Just pick what works for you and what you want to try, and do one change, one new thing at a time, so that you set yourself up for success and that you don't overwhelm yourselves with too many options or choices or too much change. So we would love for you to follow us on all of our social media channels, our website, our Facebook, Instagram, and blog. Miranda and Carolyn and Ashley do a phenomenal job with everything wellness and work life, and it's a privilege that I get to join them a few times a month to be a part of that through these classes. And so please check out these resources. And this is my contact information again. If y'all have questions, I'm happy to answer those for y'all. And we're finished up a few minutes early today, so I'll go ahead and stop record and let y'all answer and ask questions.